Hey everybody, welcome back. And you may recognize our guest again today, but this is Anna Claire.
Hey again.
Welcome back, thank you. I really enjoyed our interview that we did a while back, and I'm excited about today. So we have some items on the desk here. We're going to talk about what these are. We're going to talk about what they're used for, and we're going to talk, we're actually going to use them in our example today. And what we're going to be doing are doctor's appointments, okay? Doctor's visits. Do people call them checkups?
Checkups, doctor's visits, well visit.
Well visit. So what we're going to be talking about is not when you're sick and you have to go to the hospital. What we're going to be talking about are when you just go to the doctor to get a checkup and some of the things that you can expect when you go. I know this can be kind of scary to people. Maybe people are nervous. Maybe they're just unsure of what's going to happen when you go for a doctor's appointment. So today we're going to kind of go through that, and then we're going to show you guys exactly like what goes on. Let's talk about what we have here on the table. And I see a lot of different things. So we've got 1, 2, 3, 4, a bunch of different items. Would you kind of go through and tell us what we have?
Yes, you've got a couple different things here. All of these would be used to take vital signs.
Vital signs.
Vital signs.
And
people will say vitals or vital signs. Basically what that's doing is just kind of an overall checkup of your heart and your lungs.
Okay.
And your temperature, which, you know, we know that.
So these are things that are not necessarily like medical needs as much as just making sure they are, I mean, they're vitals. I don't know.
Yeah, it's just a good overall assessment. Make sure everything's kind of where it needs to be.
Okay, that's a good point. So there's kind of like ranges that you want to be in. And we'll talk about how you get those numbers, those ranges with these instruments. But that's kind of what you're looking for, is to see that they're doing well.
So pretty much anytime you go to a doctor's visit, or if you are in the hospital or something like that, they're almost always going to start with these couple of things here.
Cool.
These are a little bit different than what you might see if you're actually in the doctor's office or in a hospital, but they'll kind of work the same and give you a good idea of what to expect.
Awesome. Okay, well, I see a bunch of different things. Why don't we just start with our one down here? What is this little guy?
So this one is a pulse ox, or a pulse oximeter.
Wow.
It's going to measure
oximeter.
Yes, that's a nice long word.
That is a cool name.
It's going to measure your oxygen saturation, which is another long word.
Okay.
But basically, all this is going to do is go on your finger. It doesn't hurt. You don't even notice it's there, really. And it's just going to tell you if your oxygen levels are where they need to be. And a lot of times, it'll also tell you what your heart rate is at the same time.
Okay.
So all you're going to do is put your finger out. And all we do is just clip that on there. Does that hurt at all?
No, it doesn't. It's I can barely even feel that it's on there. But look, it's got a bunch of like red lights lighting up on it.
So it's going to think for a second. It'll think, and then it'll start popping up a number in a minute here.
It's like, I can tell it's reading my pulse because the numbers are, the little bars are going up and down.
Yeah.
All right, so I got some numbers.
So this top number here that says 97, that's his oxygen levels. So that's good. We want you to be, in the 90s. Upper 90s is good.
Good.
It goes up to 100. It's a percentage.
All right,
so 100
nice.
Is the max. 97, you're doing all right. You're breathing.
Cool.
Then this other one here is 68. So that's your heart rate. That's how many times in a minute your heart is beating.
And that can change based on different things, like how active I am or anything like that?
Yep, that can change with all kinds of stuff. If you did a bunch of jumping jacks right now, you would see that go up just while we were sitting here.
Oh, wow, that might be kind of a fun experiment sometime,
It is kind of fun.
Cool.
See what it does?
Well, this is like nothing. I don't even feel it.
So it's not anything at all to be worried about with this one.
Awesome.
Super easy. Sometimes in the hospital, it's a sticker they put on your finger, but a lot of times in a doctor's office, it'll be kind of this little spongy, like a clothespin.
Yeah. Cool. All right. And what is this called again?
A pulse oximeter.
A pulse oximeter. All right, cool.
You can throw that one out at your next doctor's appointment and impress everybody.
Hey, Doc, when are we using the pulse oximeter?
There you go. They'd be blown away.
All right, nice.
All right. Here's another easy one. So most
Okay.
of you at some point have probably had your temperature taken anyway.
Yep.
We've all been there. There's a bunch of different kinds. This one you would put under your tongue. We've got this one here that would go in your ear.
Okay.
They're all just kind of different ways to measure.
And now I've also seen, because like what's a common thing is like, oh, do I have a temperature? You feel your forehead to see if it's hot. They also have ones that you can actually like put on your forehead.
Rub across your forehead.
And
moms think they're really good at just feeling your forehead. That's not the most accurate method.
Okay, so that's good. So we are debunking some.
Don't tell your mom I said that.
Some old wives' tales, some myths. All right.
Exactly.
Cool.
So for these ones, super easy. All you're gonna do is just stick your tongue out, and it's just gonna go right underneath your tongue, and then you close your mouth on it, and it just Don't do what he's doing. Just let it sit under your tongue. It's going to sit there for a minute, and then it'll beep at you, and you just take it back out. And that's all there is to it. Super easy on that one.
Okay.
Again, doesn't hurt.
Yep.
Doesn't require you to do anything.
Super easy.
You just kind of hang out and let it happen.
And that's to get our temperature.
That's to get your temperature.
And the reason you worry about temperature is that having a high temperature is a sign of, well, I guess probably many things, but most commonly it would be...
So that would be a fever. So, you're thinking about infection or, some kind of illness.
Sick or something.
Something where you're sick.
Okay.
That's when you get out of school.
Oh, well, not that we want to be out of school, because learning is great, and there's too much to learn as it is, so we need to get all opportunity we can. Now, what is this thing?
So this is a blood pressure cuff. This one is a digital one. A lot of times you'll see a manual one. So those are kind of the two options there. This one just has this little screen that's going to tell us everything.
Okay.
Sometimes a nurse will use their stethoscope and listen to your pulse in your arm. Actually, you could hear the blood flow.
Wow.
And that's how you would tell without having this little screen. But this is super easy. You've got this little cuff here that's just going to go around your arm.
Okay. Now, I've done this at, like, the grocery store before.
Yeah, at the grocery store, you've got lots of options there.
Oh, not only does that not hurt or anything, it's kind of nice. Kind
of comfy? A little soft?
Yeah.
There you go.
Pretty good.
So all we're going to do on this is just press start and let it go. So that is just going to blow up, squeeze on your arm.
Yep.
Sometimes it's a little tight when it gets completely squeezed up. It doesn't really hurt. It can be maybe uncomfortable for just a minute while it blows up.
But that's intentional.
It's just because it has to be tight to get that good reading.
And then when it tightens up, then that's what you're talking about with your instrument there around your neck, that you can actually like hold on there and listen to the blood going.
Yeah, so if we didn't have this little screen, this cuff would go on exactly the same, and then I would just listen to it, and there'd be a little balloon here. I would squeeze up, and you just put your stethoscope right here, blow up that big balloon, and then as you let it out, you listen to the blood flow in this big vein right there in your arm.
Do you know the name of the big vein?
I don't. That would be a great question for my husband, who's a doctor. He knows all those.
Oh.
So that's all it is to a blood pressure. Again, super easy.
Awesome. Cool. And so we're still getting vitals at this point. So we've gotten oxygen and pulse. We've gotten blood pressure. We've done temperature.
Yeah.
Now, I want to see this. I hate that we have this here, and I haven't gotten to experience it,
This is the fun one.
So this is pretty neat.
So with these, you're going to have...
So this has a removable cover on it, right?
So these have these covers on there. This plastic cover. So
and we have some more over here too.
The plastic cover just slides right off.
Okay, nice. And
so
those are disposable, so you would just toss it.
Yes, just one time use.
Yeah.
You wouldn't share with somebody else. You'll just put your little plastic cover on there, and then this just goes in your ear. Again, nothing about this is going to hurt. Just goes in your ear, and then you press the button.
And this is taking
your temperature again.
So we did one under the tongue.
Yep.
And then we do one in the ear.
Yep.
So there's all kinds of ways to take
Sometimes for babies, you do it under their arm.
Oh, wow.
Sometimes in their bottom, which they don't like as much.
Yep.
So that's all it is to that.
Ways.
Super easy.
Wow. So we've gotten to go through all of our items over here. And we've talked about how when you go to a doctor's appointment, a checkup, that they'll do these kinds of things. Can you give us just briefly kind of a rundown of what to expect? So when you go to the doctor, you're going to go to wherever the doctor's office is. You're going to go inside and you're going to go to the office area, and somebody will probably be there to greet you. And you check in, I guess, give them your name.
Give them your name, and they'll make sure you're there for the right appointment, ask which doctor you're seeing sometimes, and then usually you just hang out and wait for a little bit until they're ready for you. And
then you'll go back and you'll get into like an exam room, which would be just like the room that you're going to sit in for your appointment. If you've been before, right, you'll have the crinkly paper.
The crinkly paper. Everybody remembers that part.
Yeah, so you'll sit up on the, what do you call it, a table?
A table, an exam table, or a bed.
And it'll have the crinkly paper on top so you can crinkle into that. and then that would be when somebody comes in, a nurse, I guess, would come in, and they would go through all of these items that we just did. And then they might ask you if you were having any issues or symptoms or anything like that.
Yeah,
that you
ask if you're feeling okay. Ask if there's anything going on that you need to talk to them about, whatever that may be. A lot of times they'll do your height and your weight then. Have you stand next to a wall as tall as you can and measure where you are there. So just a couple of things, super easy.
And then they're able to help if you have any concerns, or else they're able to just say, hey, things are looking great. You know,
Yeah.
you'll come back another time.
Exactly.
All right, I see one more item that we haven't really gotten to talk about yet.
So this is a stethoscope.
And I've seen that before. I think most people probably have,
Yes.
right?
So this is a stethoscope. It's just got this end that you would put here and listen, and this end you would listen in your ears. So with this, you can listen to your heart, you can listen to your lungs, you can listen to your stomach. There's all kinds of good stuff you can do here.
So see, I always thought, so when they're putting that on your chest, they're not always only, I always thought it was only for heart.
So depending
Heartbeat.
on where it is, you listen to different things.
Oh, so that's why they're moving it around then. Oh, wow.
So when you're in nursing school, that's one of the things that you spend a lot of time learning actually is where to listen and what you're listening for and then what all of the different sounds mean.
Interesting.
So there's a lot to it.
Is it, I don't know if you guys are okay with sharing your thing, but can I listen to it?
Yeah.
See what it sounds like? And
Check
so
it out.
these just go in your ears?
Just go in your ears.
Is there a wrong or right way?
This way.
All right, so this way.
Yeah.
Okay. Does this make me an official doctor?
I think so. That's all it takes.
I can hear a heart.
Mm-hmm.
That's good. Your heart is beating.
And then here, I'm going to take a deep breath.
And so I can hear like your lungs actually filling up. Wow.
And then you can hear like the bottom of your lungs, like down here.
And will that sound different sometimes from the top of the lung to the bottom of the lung?
So that's one of the things that we learn is what all of those sounds mean. So sometimes if it sounds good up here, but it doesn't sound as good down here,
It can mean something different.
it could mean that you have pneumonia or something.
Oh, wow.
Yeah.
Well,
Then you can listen to your stomach.
Oh. I don't hear any gurgling or anything.
That's because I just had lunch.
Okay, so you're not hungry. So if your stomach was rumbling, I'd be able to hear it really
Yeah,
good.
you can hear it really clear.
Wow. Well, that is really cool. I don't know if I've ever listened to one of these before.
There you go.
So maybe if you guys go to the doctor's appointment, maybe they
Ask if they'll let you listen. It's kind of fun.
Yeah. Wow. So what I'm finding out is that really it's not a big deal at all.
It's really not. Nothing there is going to be too scary. None of it takes a long time. There's really nothing to be too concerned.
I know when I think about like doctors and stuff, things that make me nervous are things like shots or needles or things like that. And maybe we can have you back sometime. We can talk about those more in depth. But tell me, I mean, I'm not always going to have to do that, right?
No. So you're not going to have a shot every time you go to the doctor. Usually if you are, you're going to know about it ahead of time. We've got pretty set schedules for when you need vaccines and things like that are going to keep you safe. So it's not something that happens every time. And if you do, it's going to be a little blip in the appointment. The rest of it is going to be super easy. And then that one part, we'll talk about some tips and how to get through shots.
Well, that is great. Well, Anna Claire, thank you so much for being here.
Thanks for having me back.
Yeah, that was awesome. And guys, hope you all enjoyed. Hope this helps you if you're going to have a doctor's appointment coming up, that you won't be nervous or anything. There's no reason to be. That's what we learned today.
Really not.
Awesome. Well, thank you so much.
You're welcome.
And thank you guys. And we'll see you next time.
Bye.
Bye.